future.
I think it's really important to acknowledge that there is a grieving process that goes on for both the carer, for the person that's diagnosed with the condition, and for their family and friends. When you acknowledge that it's going on and you talk to people about it, you can do something about it. And it's not something to be ashamed of, it's not something that you're not sure how to cope with. And the other thing too is that when you acknowledge that you're grieving, you can understand the emotions that you're feeling. Because sometimes people might feel angry, upset, sometimes in denial for a bit. The whole cycle changes, so it just really depends on where the person's at. But the first step really is just to acknowledge that that grieving process exists and that there is help out there for it.
We have a nurse who looks after the patient, who sees the patient also, and medication management is a massive issue for nursing. Most people don't manage their medications well. Most people aren't aware of the importance of timing, combinations, and adapting the regime to their own personal life. So her role is enormous.
As an occupational therapist, I go into people's home. It's part of the traditional role of occupational therapy to look at home safety issues, and that involves looking as to where a rail should go, or making sure there are no slippery mats or hazards around the place. That's the traditional role, but in the movement disorders program that I work in, we're very fortunate that the physiotherapist and myself can go and do visits to the home together. We call this a home visit, but we're now also calling it a home therapy session because we're able to take our therapy approach into the home environment and actually do a therapy session at home.
One of the skills we teach the people is to use a strategy to overcome whatever particular difficulty they're having. If this person was having a difficulty with walking, the step size might be quite small. The person doesn't have the ability to self-monitor or regulate what that step length is. We would encourage them to use markers on the floor and train the person in the gym to walk with a particular length of step and a particular speed of step. The idea is that the person will then be able to repeat this after training and transfer these strategies to their own environment, whereupon they will be of greater use in their home, in their driveway, and in their community.
I also want to mention that it's very important to, in the early stages, to get legal and financial matters in order. For example, that might mean speaking to a solicitor about authorising the enduring power of attorney, make sure that the wills have been completed, that a financial planner is involved in managing the long-term finances. For example, if it's the man in the family who is developing this problem, perhaps his wife hasn't had any experience with managing those sorts of personal or financial affairs. So getting advice in the early stages is essential because at that time the person themselves can make a worthwhile contribution to helping decide what the future decisions will be.